Hello, this is Mark Jacoby, and I'm gonna do a video here for the Pharmacology Assignment Module 4. I'm gonna take a look at some notes here provided for the critical thinking questions. Basically, we have the Emergency Medical Services team has brought a 54-year-old female patient to the emergency department. The EMS personnel state that the patient was found wandering in a nearby park by a jogger who called 911 from her cell phone after the woman screamed obscenities at her and then fell, seriously scraping her arm and face. The woman is bleeding, she's disorientated, combative, and accusing the EMS team of stealing her purse. Her hands are shaking severely, and she is shouting at the doctors and nurses that she needs a bottle. The woman's clothing is dirty, and you can smell a stale body odor and urine on the patient. So the first question here that we're looking at is based on the first impressions of the patient's actions and appearance, what do you suspect she's suffering from? And based on the notes from the EMS, the patient is showing signs of a mental illness due to her being disorientated and combative. Her hands shaking severely, and she is shouting at the doctors and nursing. I would also suspect that the patient is having some sort of withdrawal issue from either substance abuse, more than likely alcohol related. According to Monty 2018, patients that are in their early 50s with similar signs may be suffering from a form of schizophrenia and or a psychotic disorder. A substance or medication-induced psychotic disorder that includes alcoholism or drug use or withdrawal syndrome. In the next question, we look at what short and long-term health risks you would suspect this patient would face. Depending on the patient's diagnosis, I would note the risks for the patient to be mental health related. In the short term, the patient may have other episodes like the one she's being seen for today. Substance abuse may be a challenge for the patient. We would need to determine what she is taking, other lifestyle habits like alcoholism use. In the long term, the patient may suffer with chronic mental illness like depression, anxiety, and other psychotic disorders. In our third critical thinking question, we look at why do you think the patient's hands were shaking, and what do you think caused her confusion and combativeness? The hand shaking may be a sign of tremors related to withdrawal. They do not appear to be related to Parkinson's due to her age, and the shaking is reported in the hands only. Confusion and combativeness may be related to either her mental health illness or a combination of mental health illness and substance abuse. In our fourth critical thinking question, we look at what assessments do you think are needed for this patient? I think the patient should be assessed for mental health illness, substance abuse. Take in consideration her current living situation, if she suffered any great losses in her life recently. Does she have any support from her family? An evaluation of her mental state would definitely need to be done. And the patient may need to seek counseling and be prescribed medication for her condition. There are a number of drugs that may be used to treat symptoms such as psychotic disorders that are classified as antipsychotic drugs. Monty 2018. In our research question, we're looking at mental illness management includes both pharmacological and other therapeutic methods for treatment. Summarize how this is managed in support of insurance. Is it sufficient? And what can make it better? Be specific and support our statements with a minimum of 2 outside resources. So many health insurance plans cover mental illness and substance abuse. They may also have benefits for counseling. Private insurance companies such as Blue Cross Blue Shield, United Healthcare, Cigna, etc., may be more limited than others that are provided by the government, such as Medicare, Medicaid, and Veterans Affairs, known as VA. The state and government plans are more comprehensive when it comes to these benefits, and there are even ways to qualify for certain government insurance programs based on a disability of mental illness. Persons with private insurance may also have to pay higher premiums and deductibles for their plans, making them more difficult to access. The support and care needed would be counseling and treatment with prescription medication. According to a study published in a private sector, many offer benefits and compared to the VA for mental health. So I just want to point out, so they're saying that actually the private sector insurance plans do offer better benefits. However, the VA has made strides of improvement and deals with a much larger population than the other private sector companies. And that comes from Rosenheck, 1991. Medicare covers many benefits to care for mental well-being, including psychological counseling, preventative screenings, and outpatient treatment programs. And that's from the CMS website, 2019. Thank you. I hope this answers my questions for the assignment. Thank you for watching.